So Jane and Gladys are going to present to us about their work with the Project Tomato. Really looking forward to this, to hearing all about this. I'll leave you to introduce yourselves properly. Off you go.
Absolutely. Thank you very much, Leslie and Diane, and also for inviting us to come and join you for the first day of Malnutrition Awareness Week 2023. It's really exciting to be here again. So who am I? I am, for those who don't know me, I'm Jane Murphy. I'm Professor of Nutrition, also a registered dietitian. And I'm based at Bournemouth University, and I'm delighted to join you to share with you our really exciting project called Project Tomato, which we'll tell you a little bit more about in a moment. Gladys, would you like to introduce yourself?
Yes. Hi, everyone. My name is Dr. Gladys Yunusa. I'm actually the postdoctoral researcher on Project Tomato, and also one of the national NIHL DEMCOM fellows for the country as well. So looking forward to having this discussion with you all as well. Jane, can I just check that you can see the slides all right?
No, I can't see the slides at the moment. Anybody else?
Not yet. Okay, that's fine. Let me try another way again. How about now?
I think it's coming.
Yes.
That's it.
Okay, thank you very much.
Lovely.
Fantastic. Okay. So we're going to be sharing with you some of our work, which builds upon sort of previous work that we've undertaken, looking at nutritional care for people living with dementia, with a key lens on malnutrition, which, as we all know, refers to both undernutrition and overnutrition as well, although I think most of the focus today will be on the sort of anti-nutrition sort of part, but really thinking about some of those nutrition related issues for people living dementia and people with dementia living at home as well in this context. Thinking about how we can spot the signs of malnutrition at an early stage, something that we're as a collective very passionate about. How do we pick up the signs early and how we improve eating and drinking? And then Gladys is going to share with you much more about our Tomato project, which is an acronym which stands for Nutrition and Dementia at Home, and if time, some opportunity for question and answers. Thank you, Gladys. So just to kick off, I'm thinking about some of the eating and drinking problems that older people in general face, but also thinking about specific aspects for people living with dementia. I'm thinking about some of the challenges that people with dementia face when it comes to eating and drinking, and can see here from some of the images here on the slide, people, refusing food, probably because they don't like the foods. Oh yes, Dan, we will be showing the slides out afterwards, so no need to take any notes. One of the key problems that some people with dementia find, particularly in Alzheimer's, is maybe that memory loss, and forgetting what they've eaten as well. And also you've got some pictures here of a gentleman and a lady who just doesn't have any appetite and doesn't feel like eating as well. So the challenge is, how do we overcome some of those barriers to encourage people to eat and drink? Next slide. Thank you. So just the context of dementia, and I'm sure we'll be hearing about some of this sort of later today as well. But the prevalence of dementia is increasing, and current statistics put that at around well over 900,000 people living with dementia in the UK. But we're probably more around the million mark, and we certainly estimates put that at around 1 million by 2030, if not sooner. And a large proportion of dementia, people with dementia, live at home and rely on family and friends to support them with their eating and drinking. So we really do need to think about how we can best support people living at home and those living with dementia and other long-term conditions. And we do know that as dementia progresses, that people are more likely to have increasing challenges with eating and drinking, which puts them at risk of poor nutrition. Next slide, Gladys. So this slide just shows you some of the other sort of challenges that people with dementia have. Some of those I've alluded to already. And what you've got here are not only that lack of interest in food caused by poor mood, and we do recognise that some of the sociological aspects, psychosocial aspects of eating and drinking are really, really difficult. We also know that some people with dementia may have difficulty chewing. It's really important that people with dementia have good oral health. There may be difficulties with swallowing as well. So we do need to think about how we can ensure that we modify the food in an appropriate way to meet that person's needs. Indeed, mouth care is really, really important. Are those dentures fitting properly? Has that person seen that person with dementia? And the other thing to recognise for people with dementia, generally as we age, but also for dementia, is that people lose their ability to sense thirst and taste. So it's really important that we find ways to encourage people to eat and drink and make food appealing and appetising to overcome some of the challenges around lack of taste, thirst, and difficulty in seeing food as well. So lots of factors that impact upon eating and drinking that will contribute towards malnutrition in people with dementia. Thank you, Gladys. One of the sort of key aspects, and something that we will be reinforced, I'm sure, many times today, is that as we age, losing weight is not an inevitable part of that process. We shouldn't assume that as we age that we're going to lose weight. And one of the challenges is picking up those signs of unintended weight loss as soon as possible and doing something about it. And that is something that myself, working with the Malnutrition Task Force, the Patients Association, and the Wessex Health Academic Science Network, now Wessex Health Innovation, is keen to ensure that people know what to do and know what to do in response. And this slide sort of shows you some of those key warning signs that some people might face and that puts them at risk of malnutrition. So poor appetite, loss of interest in food, people not attending those lunch clubs and activities. You know, if somebody hasn't been attending, that should really start the alarm bells. Pressure sores, poor wound healings, all those are the key signs that that person's at risk of poor nutrition. Urinary infections, that's certainly a key indicator that person's at risk of poor hydration, so is more likely to be at risk of falls, poor concentration, or not recovering from illness as well. Some of these signs really should be picked up and responded to. Next slide, please, Gladys. So just to highlight again, I know myself and others have talked about some of the tools. These tools, perhaps not so new tools now, to identify the risk of malnutrition through a conversation. And that's something that's really comes through strong through our research. You know, through a conversation and using a series of structured questions outlined in the Patients Association Nutrition Checklist, and also in the form of the nutrition wheel, these 4 key questions, which through a conversation can identify some of the signs and symptoms of poor nutrition, but also most importantly, to signpost that person to help and support. All of these tools are freely available from the Malnutrition Task Force website. And if I could just go to the next slide, Gladys, just to highlight the video, the animation video, a fantastic animation that the Malnutrition Task Force put together. Last year, the year before, I lose the track of time, but certainly outlines about all the tools that are freely available to start conversations about eating well in later life. Next slide, Gladys. So in thinking about what we can do, what are some of the ways that we can overcome some of the barriers that I've highlighted that put somebody at risk of malnutrition? And this slide just shows you some of the sort of positive aspects of eating and drinking for older people in general, but also thinking about what we can do for people living with dementia. What is sort of key from these slides is that socialization of eating and drinking, that eating together, coming together, whether that's having a cup of tea together, whether that's having lunch, afternoon tea. But it's really, really important that we somehow embrace that, whether that's for a family, whether that's for a care worker, but just coming together and maybe just sitting down and having a chat, a drink, your lunch together. Coffee cup action is really, really important and will sort of help that person to engage in that eating process. We know that the presentation of food is really, really important. And also appetite and socialization aspects to stimulate appetite is really important as well. Thank you, Gladys, just to sort of highlight the importance of activity as well to engage people in eating and drinking. This slide here just shows the outputs of some of our work that we conducted a few years ago, focused on care homes, with a lens on that person-centeredness, how we can ensure that nutritional care is focused on the individual. And you can see on these two models, the left-hand side is our first model, and we've updated our person-centered model on the right there. And you can see there the sort of 6 dimensions around the availability of food and drink, monitoring, that relationship working together, which brings in that socialization, enhancing mealtime experiences, consistency of care, and the provision of evidence-based information, ensuring that everybody knows how to provide the best nutritional care. Next slide, please. So before we move on to tomato, just to say that these are some of the outputs, the resources that we've developed and updated since we conducted our original research. All of these resources are freely available on the website. You can see that on the slide. We've had thousands of downloads now, I'm pleased to say. So very well tested, very well used. And we've used this information, this research to inform our tomato project, which Gladys is going to talk about and share with you now. So over to you, Gladys. Thank you.
Okay, thank you, Jane, for such a detailed and yet swift overview of where we've been and where we are now. So I'll just talk to you a bit about Project Tomato. As Jane mentioned, it's an acronym for Nutrition and Dementia at Home. And actually, we began last year in November and has been running ever since. The main aim of the Tomato Project is really to work together with home care staff, people living with dementia, people with lived experience, obviously, in this case, people living with dementia, their family carers, to really look into how we can improve the provision of nutritional care for people living with dementia at home. So slightly different context than the care home or the hospital. The home care sector is a completely different sector entirely that we are, drawing our learning from as well. And it has really been insightful to work with home care organizations across England. We're currently working with four home care organizations who are uniquely positioned in their own right. And so lots of insightful learning will hopefully come out from at the end of the project. It's a feasibility and acceptability study, and we'll be using a mixed method approach to draw insights from the study. It has been designed to be delivered in 2 phases. We've currently just completed the first phase, that's the phase 1. Obviously, in terms of what we've done so far, besides the ethics approval, is that we've sort of set up a PPI, very active PPI group consisting of people living with dementia, family carers, and home care workers together, having conversations and really steering the direction of the study as we progress along. And so we've had about 3 successful meetings now since we began last year. As part of that, we also have a very vibrant project steering group who are sort of on a more strategic level, steering the direction of the project as well. And we have representation of, healthcare professionals, policy, people from policy as well, represented within that group. And so it really has been a collaborative effort from all sides, honing into how we can collectively look into the situation and how we can, do things better. We do have a multidisciplinary experts team, and you can find out more about that on our project webpage, which when you do get the slides, that will take you directly there. For phase 1, I will just say a bit more about what we've done. So for phase 1, we've taken the resource that Jane has just clearly showed you, the previous work that was done in the care home settings, and drawn on how we can sort of adapt it to suit the home care settings. Looking at the resource, for example, the booklets, we've, drawn on feedback received from all the key stakeholders I've mentioned earlier. And so we've revised the resource to suit the home care setting. The language has changed. Even the representation of images as well has changed, but we want to sort of trial it and see going into phase 2 to see if that is, has been helpful to the key stakeholders as well. So again, we did that through interviews, really in peers and individually as well with the key stakeholders. And we do now have a booklet. So we've got one of the main feedback that came back from the home care staff, which we are learning that the terminology itself, like there's so many ways that you refer to home care workers within the home care setting, but now we're calling them home care professionals. So we've gone forward with that, with that, that term. So home care professionals. We've got the full detail resource guide, and we've got like a handy guide, which was what they wanted. They wanted something that was easy to carry along with them as they go on home visits as well. Alongside that, we do have the family carers handy guide as well, so that can be almost like a prompt to stir up conversation, and also open opportunities to have that, full circle conversation around the person receiving the care as well. So that will be available hopefully as we wrap up with phase 2 next year, end of summer, fingers crossed. But just to let you know that is coming soon, so be on the lookout for that. In terms of phase 2, we do want to test the intervention. So we want to see whether it's feasible, whether it's acceptable, as I've mentioned earlier. We are currently delivering home training for home care professionals at the moment across those 4 home care providers represented across the country. And we'll be collecting some, pre and post quality outcome measures as well. We also want to test whether or not the approach is cost effective, and the whole process evaluation to then determine next steps moving forward. So again, working very closely with people living with dementia, family carers and home care workers as well. At the end of it, we'll be having interviews again to just sort of gain that further insight on what they thought about the intervention as well. Right, so this is linking back to the, in terms of using validated tools to support the science of poor nutrition. One of the things that we had to quickly realize is how can we make use of, for example, the patient association nutrition checklist in a way that is very feasible and practical for frontline home care professionals. And we will be trialing that as part of this intervention as well. So what the homes are doing is to sort of embed these 4 key questions within their care provision for the participating dyads, so the person living with dementia and family carers, and to just sort of see how they can begin to engage with and again raise the awareness of spotting the signs of poor nutrition as well. So this will be tested as part of the intervention that we are moving forward with for phase 2. We will run the project till about next year, August, as I mentioned earlier. And if it's feasible and it's acceptable, I think that the insight from the study will help to inform future design to test the effectiveness of the trial. So we still have a long way to go, but I think all things are moving in the right direction moving forward. Lots of learning, and again, it would be really nice if you wanted to keep up with us and how we are progressing with the project. Feel free to go on our webpage or just drop us an email, myself or Jane. I'll be more than happy to keep in touch with you as well. Okay, was there anything you wanted to add here, Jane? Can hand it back to you.
No, nothing from me, Gladys. Thank you. You've covered some also really well, but we're just so excited. And thank you for your hard work and all the team. It's been an interesting journey, undertaking research with certainly an under-researched part of the community. Home care provision is not an area that has been involved with a lot of research, and it's a privilege to be working together with some sort of fantastic providers who are doing some fantastic work, and going forward hope to sort of share some of that good practices.
Thank you very much. That was great as always. And I think that reiterating the importance of picking up signs, before there's a big problem, and what we can do to improve the quality of eating and drinking in care homes with people living with dementia, how important that is. And adapting this intervention for home care, because as we know, it's so important, because that's where a lot of people fall down with home care, when we're not looking at them having nutritious food, help to eat when they need it. But this is great, really good piece of research. So this presentation, along with the others, will go on the website really in the next couple of days, so you can link into all the links there. And I would urge you to look at the resources, because they are really great and helpful. And I'm sure that you'll be able to find something that you'll be able to use within your own practice. So thank you, Jane and Gladys. That's great.